And is coercive control, is it always psychological or can it be, is it always physical or can it be psychological? Again, the only reason I'm saying that again is just especially in light of, the recent Diddy trial. A number of questions that I've been receiving or people asking questions is that how can it be coercive control where I'm just using them as an example. Or how can you have coercive control when with someone that you're in a relationship with? That's not possible. Or the person after showed that they were happy to be in this relationship with this person. So again, I'm just trying to help people understand, of even for myself, if someone has been coerced in their relationship, does it mean that they are always going to be in a place where they feel they have been coerced, or can they then show signs that they're actually happy to be in that relationship?
It happens mainly in intimate relationships. So I think that's often a misunderstanding that this is something that happens outside and these encounters that aren't from intimacy. It usually develops within relationships where it's someone that you know, someone you trust, someone that you've opened up to and committed to in your life. So it may not start out that way. And I think in many cases, even this trial that we're hearing now with Diddy and Cassie Ventura, it starts out as maybe a loving, intimate relationship and starts to slowly build into that. So it can start out with coercive control. Couples can also heal through that. I've seen a lot of couples actually come to therapy and seek support for help around some of these patterns where a partner is willing to change and is aware of some of those patterns of harm that they're doing to a partner. And for others, it can escalate and develop and get out of control. And these patterns can be hard to know how to manage or where to go for support or what to do. And when there's trauma can leave us in a state of freeze and dysregulation where it's hard to access, you know, making good choices and seeking help, or that control has isolated any resource available for you. So yes, it's most common in these relationships, which is why we need to talk about it and help people be aware of how to notice the signs and what to do when you how to help yourself when you're in that situation.
And for someone who has been in that type of relationship, is it something that you'd recommend seeking help from a therapist? Or, and again, forgive me, it sounds like a silly question because this is what I do receive. Or would you say they should just speak to a religious leader, who maybe not be qualified, or a family, a friend? What advice would you give to someone who's been in a, or who is in a relationship where they're experiencing coercive control and trauma?
Well, the advantage of working with a therapist is you're going to have a trauma informed lens. Most therapists have that background and training. And with having that trauma informed, you're going to put language to what's going on. These patterns of behavior, we don't want to just stigmatize or label that this person has this or that. We want to look at what's actually happening in the relationship. These patterns can be, it starts out, I'm walking on eggshells, it's hard to talk or have a voice in the relationship, to absolute control and disempowering the individual. So therapy will really help in addressing and unearthing those patterns. I think for those that feel safe and comfortable going to maybe a religious leader or someone in the community, the advantage of that is at least there's disclosure and someone that can advocate for getting better help or support. I think what's often concerning about people that might not be qualified is, what if I'm not believed? What if what's happening in my relationship is minimized? Or what if I'm told that this is normal? So many people end up feeling silenced or isolated in getting help, or they were told this is nothing, or you need to work harder on your relationship or marriage. And I think that can do a lot of damage, obviously, and create a lot of shame for that individual. So the advantage of having someone specialized in this is they're going to see that and recognize that and help put you on the right path to healing and taking care of yourself, which may mean getting out of this unhealthy, abusive relationship.
Yeah, no, I agree because I have a number of friends who are like religious leaders, like imams or community leaders, and most of them will say that at least 80 to 90% of the queries they receive is in relation to like counseling, relationship issues, marriage issues. It's not about like the actual religious rituals, shall we say. And many of them are now thrust into being pseudo therapists and counselors, and many of them haven't got the adequate training. And one of the challenges again is that sometimes I've noticed people might diagnose things that they've heard, things like addiction, or say that someone is a narcissist without because they've read something in a book or watched a YouTube film or something or whatever. So that's why again it's important that we highlight,
Yes.
like you mentioned, qualified individuals like yourself who can provide the necessary services. And obviously, if there's a diagnosis needs to be had, you know, you can provide it. I just think that that's something that, like I said, because I see it time and time again, where people will who are in positions of authority and power, but not realizing where their boundaries are. So because you might be an expert in the Bible or the Quran, that's very different from being an expert in psychology, or because you might have a degree, that doesn't necessarily mean that you're licensed and qualified to provide services. So that's why I just wanted to. I don't know if you've found that because again, it's just something that I've seen quite a bit, and it can be quite frustrating because then sometimes people not qualified will then say things or maybe normalize abuse and not realize what they're saying, and then obviously the person, like you said, can feel like what they're going through is being minimized. So that's something which again it's definitely a challenge,
Exactly, it's
especially.
so vulnerable to tell anyone what's going on, especially when there's abuse or things that we don't understand ourselves. So you're opening up and then being told what their perspective is based on their experience, which may be very limited. And to be honest, I see this happen a lot, even with therapists in the field that might not have adequate training, especially as a specialist in sexuality. I'll work with a lot of clients that have been shamed by therapists or been told it was this or your fault or you need to do that or you need to, things that's not our job to advise a client one way or another. We're really helping to build that awareness and helping them make good decisions by educating them and giving them the tools. So I've seen a lot of that happen, even with qualified professionals. So I recommend that people make sure when you are speaking with someone to talk about what their background and training is in this area. How have they worked with cases like yours? What are the outcomes? What is their approach? What are their own values that shape the way that they work? And I take it to heart, this work that I do. It's so personal. So I want to more than anything make people feel safe and comfortable to express themselves and not to judge them. There's so much judgment, even by therapists, that I've seen a lot of damage being done. And I want to protect people from that. That shouldn't be your experience, but it happens more often than not.
Yeah. And this is linked to what we spoke about previously about coercive control, and this is I kind of ripped this off from your. And if anyone is interested, please check out, and I will send a link to Dr. Shannon's website. But there was a really good article that I wanted to kind of ask a question about. Why do public figures engage in risky behavior? And can you help us understand the psychological and behavior factors that contribute to such behavior? And could this behavior be classified as an addiction?
This was a hot topic when I first started out in this work. So, sex addiction was a big buzzword in the media. Public figures, I think, like anyone who has a lot of power and privilege, they have accessibility, they have a certain level of invincibility and protection. So they don't have as much accountability as the average person. They have a lot of protection around them and use that power in ways to get away with a lot of this behavior. Also, I think with the more power and less accountability, it changes their relationship to sex and sexual behavior. There may be more power dynamics and control, and it's less about intimacy and more about this sort of self-serving behavior. And I think we see it a lot with politicians, these public figures that are under a lot of scrutiny and also have such a pressure to withhold this public image. And when I work with clients like that, I find that incredible amount of pressure just help. They're crumbling underneath. A lot of them are seeking, they're almost living these dual lives. They feel like who they really are is something they have to hide. So I see that sometimes showing up quite a bit in these compulsive sexual behaviors. It's not necessarily about sex, but it's about an escape. It's a coping mechanism for these incredibly overwhelming emotions that they're not able to manage on their own. And I think that's my biggest issue with the term sex addiction. People hear that and they think this person is addicted to sex. And if we just treat the addiction, then they won't have the problem anymore. But at the root of that, I see someone in a lot of pain. I see someone who doesn't know how to cope or deal with these overwhelming or underlying layers and emotions. Someone with a trauma history that has never had any treatment or help and is using their position or role to cope or fill voids in their own internal world. And that leads to a lot of shame and secrecy and definitely, more prone to these types of behavior. You'll see a lot of similarities in profiles of people who have compulsive sexual behavior.
Yeah, so the compulsive sexual behavior, is that the same as sex addiction, or is that something different?
It's actually all based on, it's interesting because even in our field, people will say it's not an addiction. This is the way to refer to it. I refer to it as compulsive sexual behavior because I don't necessarily think it's an addiction like we would look at chemical dependency. I see it more as a coping mechanism, a way that people learn to develop protective behaviors or mechanisms or defenses to deal with or not deal with emotions that are happening under the surface. I would say the compulsivity sometimes acts like an anxiety or an obsession. And so we can look at it like we would some of those clusters of behaviors in mental health. And that's how I usually treat it. If we can develop healthy dependency and even a healthier relationship to sex, so it's not something that you're using to manage stress or deal with overwhelm, it shifts the way that you're using that behavior. So it's not necessarily an addiction. And my problem with that industry is that they were sending everyone into this sort of treatment mill model, and it was shaming, it was stigmatizing, it wasn't sex positive, and it was kind of just creating more internalized shame. And I saw a lot of people coming back into treatment after going through a full, sex addiction treatment program. So I think the programs have evolved a lot, but there's still a lot of area for improvement.
And is that the same as porn addiction? Would that be the same in terms of how it's not really an addiction? It's, as you explained, a compulsive sexual behavior. Is that the same as well?
Yes, I mean, I look at phone addiction and sex addiction or porn addiction very similarly, right? Anything that can claim our consciousness can feel like an addiction because we develop a dependency. There's an instant gratification. It's a way that we can kind of deal with or band-aid over these issues going on underneath the surface. And I think porn is tricky for people because they think porn is the problem, right? If we just take away porn, then we won't have compulsive behavior. What we've seen so much in our research and work is that when you take away porn, they will develop another form of dependency very similar to that. So I call them more process behaviors or compulsivities. So things that we're doing to cope with internal problems. And I don't think porn's the issue. I think that that just becomes the source of how that person is using it to escape, to isolate, and to deal with a lot of underlying issues, self-esteem issues, confidence, lack of skills or awareness around sex. And it's not really about pleasure. That's, I think, a big misconception. People think if someone is compulsively using porn, that they are in this state of enjoyment or pleasure or euphoria. That's the very short-lived part of that experience. Much of it is shame and isolation and loneliness. So it's a very stressful and distressful experience for someone dealing with this.
And how? Because I often hear people cite a number of research papers. I don't know how accurate they are about sex or porn addiction in particular, damaging the brain and things like that. How true and accurate are those? Like, again, I often hear that from especially people from a religious perspective, whether from a Christian or Muslim perspective, talking about obviously like the epidemic of porn addiction and how it destroys or messes up the brain and things like that. And they cite some neuroscientists. Um, are those sources correct and accurate? I'm just wondering.
I'm smiling because they're very sensationalized. I remember this website, Your Brain on Porn, and it had these brain scans, and here's what's happening to your brain. It kind of reminds me of, in the 80s, they had the Your Brain on Drugs and these very, emotional, dramatic commercials. And of course, anything that we're doing can impact our brain functioning. I'm pointing to my phone again. Our phone and social media and scrolling has the same impact. I think when sex addiction first came out, they showed these very prominent brain studies of here's a brain on cocaine and here's a brain on porn, and they look exactly the same. Now, let's be real here in terms of neurology. Obviously, the same areas of our brain are lighting up if we're using something that feels stimulating to us. These are the reward centers of our brain. This is where our dopamine and neurotransmitters that make us feel good are releasing chemicals. So it's hard to prove that, even though I know these sites really have a strong argument with all of this pseudo research and neuro studies, but I think that it's very limiting. And again, it's sort of demonizing porn as the issue when I think I would clearly argue that phones, media, any sort of stimulation that's similar in that way can have the same impact, if not more.
Assalamu alaikum. Good evening, everyone. My name is Habib Kande, founder of the Eritology Institute. I'm pleased to say